Your Majesty, Excellencies, ladies and gentlemen, it's a privilege to be here to share experiences on constructive solutions to the threat of drugs and the epidemic abuse that we see in so many countries. I thank the Pontifical Academy of Sciences for arranging this important workshop. The Mentor Foundation is an organization dedicated to preventing children and youth from falling into drug abuse. I appreciate the opportunity to share with you what we have learned over the past 20 years, and I look very much forward to learn from everybody here about concepts, how we can work together. As Her Majesty said, we have a very special responsibility to protect children and young people from using drugs. The damages to the young developing brain is much more severe than for adults. And I'm sure that several of the scientists here today will describe that in more detail. I'd like to start with giving you a short background on our work. The Mentor Foundation was founded by Her Majesty Queen Silvia in 1994 in Geneva as an independent, non-governmental, not-for-profit organization working on international drug abuse prevention for youth. The organization was founded in collaboration with the World Health Organization and was officially launched in United Nations in Geneva in 1994. We have learned a lot during the past 22 years, and our focus and methods have gradually changed as we have adapted to the change in the world and to the knowledge that have evolved from research. Since the start of Mentor, we have undertaken and supported more than 60 projects in more than 80 countries. And that has had an impact on millions of children and young people. We have also established 7 national offices working in Sweden, UK, Germany, Lithuania, USA, Latvia, and Denmark. And we have also established a regional organization in Lebanon, which serves and coordinates programs in 22 Arab League countries. These local organizations enable us to work directly with many thousands of youth and to build strong networks in those countries where we are. Our vision is a world where children and young people are empowered to make healthy decisions and live free of drugs. We deliver and evaluate programs to prevent drug abuse and to support positive youth development. And we campaign for better youth development and prevention practices and policy. There are many factors associated with an increased risk of alcohol and drug problems among young people. And these factors, if I look at the individual level, it's the low level of well-being, lack of self-esteem, lack of belief in the future, early introduction to substance use, and a positive attitude towards drugs. There is also a genetic predisposition, and I'm sure we will hear more about that today. When there is also lack of self-control, aggressiveness, and antisocial behavior, it all represents an increased risk. Looking at the family level, if the family has a history of abusing drugs, if the relationships with the parents are negative or non-existent, if the parents have a very low aspiration for the child, and if there is inadequate supervision and lack of stability in the family, and there could even be maltreatment. Looking at the broader perspective, if you look at the school situation and friends, if there's a negative relationships with adults in general, and low commitment to school, lack of people to trust, and a negative peer pressure. If we look at the community perspective, we know accessibility of drugs is absolutely everywhere, but depending on how easy it is to get it and how frequent it's used around the child and the young person, it's of course an additional risk factor. And we see also, of course, drug abuse in all socioeconomic groups, but we also want to see extra vulnerability connected to the socioeconomic situation. So given this, as an organization, of course, we know we cannot work with everything. But at Mentor, we base our work on a holistic approach that includes the individual, the home, the school, and the community. We have identified those factors that we know that we positively can affect. And our programs focus on strengthening the following key protective factors. And those are the self-esteem, the belief in the future, the attitude towards drugs, and to improve the parental relationships, and very important, to provide another adult in the young person's life. And research show that having multiple positive adult relationships is one of the primary protective factors against destructive behaviors. So all of these, we can say, is protecting against the downside. We are also very much building on the upside. And what I mean by that, we're helping to see meaning with completing education and also inspiration towards employment. It's very important for an individual to have a positive goal to work towards, rather than avoiding negative risk factors. So it's as much about preventing the downside as it is to build on a fulfilling life on the upside. And someone mentioned the importance of sports here earlier today, and of course the sports is another factor for the upside. So we have therefore developed 3 core sets of programs that are now offered in all our Mentor national countries. And these programs are built on strengthening an adult role model in the life of the youth. And the 3 main programs are individual mentoring and group mentoring for job inspiration and parenting support programs. The parenting support programs is very much about helping parents communicate in a constructive way with their children and helping them to see the signs. The individual mentoring, it's primarily in most countries is for children in the age of 13 to 17, and we focus on vulnerable schools. With the career inspirations, we bring people from the business community and other people with work-life experience to inspire them to all work towards completing school and then looking for jobs. So the reason these programs have been selected as our core programs is that they have proven to be very effective in building up resilience against risky behavior and drug abuse. The programs are designed to build up confidence and motivation, and for the young people to see the positive outcome of a healthy lifestyle. We build the confidence in young people that they can succeed in developing a fulfilling life. And as we all know, the dream of a positive future is a very strong motivation to stay healthy and make good choices in life. So through our core programs, we can see strong improvements in the self-esteem, in the belief in the future. The attitude towards drugs changes drastically, as well as the relationship with the parents, if there are parents, is improving. And the general trust in grown-ups is improving. A growing number of refugee children are now becoming part of our programs in several countries. In Sweden, they now represent almost 20% of the participants in our program. And this is a rapidly growing number. We have therefore brought together Mentor Sweden, Mentor Germany, and Mentor Arabia to set up special training and support to to the mentors to be able to handle this very vulnerable group of youth. So over the years, Mentor has built strong partnerships with organizations in different parts of the world. Earlier this year, the UNODC launched the Listen First campaign, which we are part of supporting. The campaign highlights the importance of listening to a child. And in line with this, our national member, Mentor USA, has started a program called Shattering the Myth, together with NIDA, the National Institute on Drug Abuse in the United States. So the program brings very large groups of youth together with scientists in a form of town hall meetings. The youth get an opportunity to ask questions about drugs, and they get the facts from the scientists. Then the young people have an opportunity to, through slam poetry, to express their thoughts and fears around drugs. And there is a lot of grief that most of the young people feel around drugs. So this is a very powerful program. It's now under evaluation by the George Washington University. In Germany, we have developed a program called Rebound, together with the University of Heidelberg, aiming at preventing high school students from risky behaviors. The youth participating in the program are encouraged to see themselves as agents of their own development, similar to the program in the United States. And Rebound use film as a medium. This program has reached 10,000 youth in Germany. In the UK, we are working as project partners with the implementation of the primary school program called the Good Behavior Game. This evidence-based classroom management program is offered in the United States, Europe, Africa, where it has shown strong effectiveness in reduction in risky behaviors in later years, even though this program was started so early. We have done further programs. It's a 2-year project with a school prevention program called Unplugged in Croatia, Kyrgyzstan, Lithuania, Romania, and Russia. The project served to start prevention initiatives for 12 to 14-year-olds in those countries. And it was done in project partnership with the European Union Drug Abuse Prevention, UDAP. The implementation of this program is now handled by local organizations in each country. But in several of the Arabian countries where we operate, it's now being implemented by Mentor. We also undertook a program called Prevention and Health Through Sport with the International Olympic Committee. The program is a partnership with a local organization in Uganda, UDAL, and it's now successfully spreading in Uganda through this organization. So I think we all know the tremendous suffering that drug abuse will cause the individual and the family involved. And there is also, we should remember, a tremendous cost for the society. Several studies have been reviewed to look at the social return on investment on prevention activities. And as a case study, the Boston Consulting Group took a specific look at our mentoring programs in Sweden. Their study indicates a conservative estimate of savings to the society with a multiple effect of up to 15 times. This means that every krona, every dollar, every euro that is invested into these programs give a return back to the society for up to 15 times. And those costs that have been accounted for in this, first of all, this is only accounting for those people who would otherwise turn into be heavy drug users, which we all know is a relatively small number. So we don't even account for those who are moderate drug users. But the costs that are looked upon in this is the medical, social, and judicial cost related to drug abuse. But it's also the reduction of unemployment cost, And if we look at it, it's also the positive contribution of a higher income and therefore taxes into the community through the higher education as a result of the prevention initiatives. So this is all based on official statistics in Sweden and through the research reports in Sweden. And the benefit, if we would calculate even more good things coming out of these individuals who wouldn't turn into being drug addicts, but contributing members to the society, we could calculate up to 30 times the investment. My point with this is that good prevention generates important long-term value and saving for the community beyond the vast personal suffering. Now, the collaboration with all sectors of the community is important to reach good results with prevention initiatives. I have mentioned the importance of the family and the school, but I also like to point out the importance of the business community. Our learning is that this sector has been crucial as partners in our important mission. This is where our youth find the inspiration and hopes for the future. The business sector, they provide their employees as mentors in our program, and the sector has been providing steady funding to our organization. We could never have reached so many youth around the world without the business sector. And I'm saying this because I think this is important for all of us to bring with us when we talk about actions, how we move forward. I think it's really important to include the business sector. I think many of us here feel at times quite frustrated that we cannot reach more individuals with good prevention initiatives more quickly. But it's important to recognize the ripple effect deriving from individual actions. There is much to be learned from studies in consumer behaviors. Studies prove that a change in attitude in one person transfers over to other people. The initial action has an impact on others, and it also gives an induced effect on other people further removed. And based on such studies, the Boston Consulting Group reviewed the impact of our prevention programs in Sweden during 2015. They estimate that for every participant in our program that we work directly with, there is additional 2 people that have been indirectly affected by these 2. And they are close families and friends and so forth. But there's also an induced effect on almost 2 more people. So if we look at this picture, 86% of the participating youth in our program they reported that they have an improved self-esteem. We reached 17,000 youth, 13 to 17-year-olds in Sweden in 2015. And if we look at the ripple effect, that means that it's at least 40,000 indirectly and 30,000 on an induced effect, which in total will add up to 90,000 people. And I think this is important also when we look at initiatives. As much as negative influence will affect, positive will also. Since we started with these programs in Sweden, 60,000 youth in this group have been affected directly by the programs. And if we look at the indirect and the induced effect, it's a little bit less than 300,000. And of course, this has had an impact on youth in Sweden and on Sweden. The international collaboration is crucial for success. And I really want to applaud the UNODC and the fantastic work that you do, and in particular the international prevention standards that were recently announced and presented by the UNODC. Mentor has, together with many other organizations, we have shared our experiences, and it's all part of what you see there. We also very much appreciate the opportunity to participate in the Vienna NGO Committee on Drugs, where we, together with many others, can affect and communicate with the agencies working on policy. I also want to mention the Prevention Hub. This was developed by Mentor as an online portal forum for exchange of knowledge. It's geared towards practitioners, teachers, NGOs, and parents. And it provides information on good practices and information relating to prevention. It provides training tools, webinars, videos, and so forth. We're very pleased that this is now handed over from Mentor to UNODC to be maintained for the future. Now, I want to say a few words about how the drug scene have changed, of course, in 20 years. The access a young person has to drugs and to information is just a click away. And this means access to illegal drugs as much as information about what's called legal highs in all form. And this is truly a new threat. And someone looking at this product might think that they're not very harmful, and they are sold and marketed as good value. And as we have heard, they're actually, in many instances, even more dangerous. So this is what it might look like for a young person, like a chewing gum or whatever. And they also come in nose sprays and Band-Aids and so forth. So this is one threat. I think the other one that has also been touched on is the epidemic abuse of prescription drugs and opioids. And behind all the frightening statistics, there are lost lives and traumas that I like actually to bring into this room also for our further discussion. I'm going to show you a short film that was sent to us by a father who lost his son. And he says that since the death of my youngest son, Mark, I have asked myself so many questions over and over again. What if I had talked to Mark more about the dangers of drugs? If I hadn't missed the signs of addiction problem, would he still be alive? He died a week before his graduation, and I'm going to show you this film.
I was the first to leave, precious child, but in this world, I was left here to grieve, precious child, in my soul, there is a hole that can never be filled, but in my heart, there is hope, and you are with me still. In my heart, you live on, always there, never gone. Precious child, you left too soon, though it may be true that we're apart, you will live forever in my heart. God knows I want to hold you, see you, touch you, and maybe there's a heaven, and someday I will again. Please know you're not forgotten until then. In my heart, you live on, always there, you left too soon. Though it may be true that we're apart, you will live forever in my heart. Hi, Marky. Hi.
So, this sad story that we have just witnessed is the reality of millions of people around the world. Mark, as we all saw, had a supporting family he grew up in, and even so, he lost his life. Now, Mark's father spends most of his time spreading this message to youth and families in hope that it will save others. Our work here today and tomorrow is to prevent further spread of this epidemic threat to our world's children. There's a saying, it takes a village to raise a child. And let's add, it takes a focused global community to tackle the problems that face our youth in terms of threats related to drugs. So with this, I thank you again for this opportunity to share this, and I look forward to our further discussions. Thank you very much.